Hello everyone, I'm Divyashini from Group 3 and today I'm going to be presenting about positioning of patient in supine and semi-supine position. So proper patient positioning is an important part of ensuring that a surgical procedure is safe and effective. Determining a patient's position for a procedure is determined from a pre-operative assessment and is based on factors like the type of procedure, length of procedure, patient's ability to tolerate the procedure, exposure required by the surgical team, anesthesia access, and among others are also included. So one of the four basic patient's position is known as the supine position. So what is the supine position? The supine position is one of the four basic patient positions where the three other positions are prone, lateral, and lithotomy position. So in supine position, the patient is face up with their head resting on a pad positioner or pillow and their neck is in a neutral position. The patient's arm is maintained in a neutral thumb up or supinated position. It may be tucked at their sides or abducted to less than 90 degrees on arm boards. So when do we use a supine position? A supine position is a positioning used for intracranial procedures as well as procedures on the anterior surface of the body. Typical supine position procedures are also cardiac, colorectal, thoracic, abdominal thoracic, endovascular surgeries, laparoscopic surgeries, upper extremity surgeries, as well as lower extremity surgeries. Often, procedures on the neck and face are performed in supine position. The benefits of supine position is that it is one of the most natural positions for a patient and it usually allows the patient for anatomical structures to remain in their natural neutral alignment. Most patients are able to maintain adequate compression on the respiratory system and respiratory function when there is no constricting. The supine position also allows for excellent access to the anterior structures of the body. And the supine position is also one of the safest positions for stability on the surgical table. It is easy to ensure that patients' safety straps are placed and with the entire body supported, the risk of injury from falling is further reduced. Now, the difference between supine position and semi-supine position. Semi-supine position is a position which refers to where the patient is lying on the surgical table but with additional articulations. So these articulations are commonly referred to as the lawn chair position, where the hip and knees are slightly flexed and above the level of the heart. The position can elevate pressure on the patient's back, hips, and knees. A lawn chair position may be used to assist with relieving tension on abdominal structures or drainage from the lower extremities of venous blood. There's also another articulation position which is known as the frog leg position. It is a variation where hips and knees are flexed and the hips are externally rotated. This may be necessary to assess anatomy such as the groin, rectum, and inner thigh. This is also used to ensure the patient knees are supported to avoid stress on the hips. That is all from me today. Thank you so much.